I did mine in the summer. I just got it over. I didn't have money at the end of summer before school started, so yeah, I'm gonna do mine the next time Wizard comes to Prescott. But I know that would be a huge helper.
Yesterday, what was yesterday? Thursday? Yeah. Yesterday, Miss Windsor was like,
"Don't take ACLS."
No, she was like, "You have a spring break, but I recommend you don't go out of town. What do you recommend we should be doing?"
Have you finished your cardiac modules?
Yes.
Because those would be a good one. I did all those in the summer. Anything that I could do over the summer that I had to turn in, like the cardiac modules we did over the summer, the side stuff, all of those modules, get those done. We didn't have anything like that. If you have already done your site clinical, please do yourself a favor and finish that paper and get it out of the way.
Oh yeah, I have to do that.
My paper was 38 pages long. I did really great on it, but it takes some time. And make
38
sure
pages?
Yes. But half of that is like what she's telling you to put in there, so don't worry about it. Hers is 15, and you just do the template.
Follow the rubric, you'll be fine.
Follow the rubric, and go back to your first notes.
It takes a long time.
And everything on the site paper is you have to have. Don't skip anything. It didn't say that it was mandatory, and I didn't put it in there. And she, I was literally working on my paper the day before pinning because she had a back injury and wasn't responding to blah, blah, blah. So, yeah, don't put it off because I did, and I was miserable. I did not enjoy the week before pinning. My daughter had surgery, and instead of taking care of my daughter after surgery, I was doing the damn paper.
I thought the paper was actually a pretty good learning tool, but just go back and look at your mental status exam notes and make sure you cover it and use those keywords because that's what they're there for.
I
and you want it. It took a lot of time, but it wasn't difficult, and it was actually pretty valuable. Like I felt like I really had down the mental status exam, and if you get questions on your NCLEX, you just write a 30-page paper on it, so you know it. So I didn't think it was that hard, and I thought it was really valuable. And just make sure you address everything. When in doubt, include it. And look at that mental status exam and exactly what they're asking you, and maybe make a questions page going into your interview with your client. Because then you're kind of covering it all. So that's my advice there. Is the paper really not that hard? It's just a little bit time consuming. And do it over spring break if you have the opportunity. If you already have your site clinical.
I just finished.
Okay, yeah, do that. Get that over with.
But even if you haven't done your site clinical yet, you can still do the article and start looking up
that. I wrote my article review before I even landed on thing.
And you just adjust it for your facility after, but the basic is already written.
For us third semester people that have a whole entire summer before for it.
Do as much as you can.
If they open it,
do our modules and stuff.
Do all your modules, have it all ready to go, and it might be more helpful to do it as far as learning wise in the course. But I thought it made me have a really great basics going into it. I already knew a little bit about it, and so whenever we tackled it in class, I was like, okay, I've heard of this, and I kind of know what we're talking about. So I felt like I didn't take as long to learn the material per se because I prepared myself ahead of time. So do as much prep work as you can. It'll make fourth semester go by a lot easier. It's already hard enough without spending 12 hours on site modules.
Yeah. Because they're just
I liked them,
time consuming.
but they are.
With psych, did you guys read?
Yes.
You did.
I did all. Okay, I'm gonna be real with you guys. I'm
I
not
feel
trying to
like
overachieve.
people didn't read because she pretty much gave you everything in her notes.
She does, but if you really want to know
I
psych,
disagree. I think there's stuff in there that you have to get out of your reading.
and I agree. Okay, I'm gonna be honest. I did almost every single reading and every single assignment for psych before class started. I had already done all the reading. I had already made my notes. And I'm gonna grow a little bit.
We had all summer.
We had all summer, so I was done. Going into it, I already had it. But when we got to those lectures, all I had to do was go back and review my notes. All I had to do was go back and review the plan that she made or whatever. And it was really great. It was really helpful because I was able to devote more energy to theory where the material was maybe a little bit more difficult as far as it being a little bit more scientific. And there's a lot of science in psych, but I had already covered it.
Psych is much easier reading than
it's more
any
interesting.
of your other stuff.
It's way more interesting.
Just go take a couple hours and read the book. I'm telling you, it'll do.
And it flies by pretty fast.
So because I started getting the feeling am I wasting my time reading this when I could be reading for theory?
Yeah, it wasn't really the dilemma I had because I already had it done.
That's a hard one. I have so many crazies in my family. I just happen to each of their diagnoses. But I felt like her lectures were kind of scattered. She'll tell you when you absolutely need to know something, so it's just kind of, like, I didn't read, so, you know, I survived with B. So,
I thought the lectures were really valuable. And I thought that the study guides and stuff that she made, all the materials that she gives you are really valuable materials. And she knows her stuff. She knows her stuff. So if you ever have a site question, you need to go to her and ask. Because she knows it, and she'll tell you straight up, like, this is how it is, and then you know it, and you're good to go.
I think the outlines were great. I think the lectures were great, and I think there's questions on there that you're going to have to go read.
You do. And make sure you fill out those outlines and stuff that she gives you.
But theory is more important.
They're both
Honestly,
credits.
like, knock on wood, I've never heard of anybody fail psych and have to repeat 4 semesters because of psych. So, it
But if you
always
get a psych
comes
job,
down,
you'll be really happy.
it always comes down
I got a
to
psych job. I'm
theory.
doing detox.
Oh, yay.
So that's really valuable. I think for this, I mean, the theory part of it, as far as they could like, die on me, they could go into cardiac arrest. Like I need to know that. I really need to know my 4th semester stuff, but I also need to know the psych stuff. And the psych stuff I think is valuable in all of your clinical settings because you're going to use that.
Absolutely.
Exactly. Because who knows, they could be in there because they have a heart attack, but they also have schizophrenia.
Yeah,
So
you need to know that.
that would be helpful. Or they're depressed. A lot of them are. Like I'd be depressed if I was in the hospital. To be real. So I do think it's valuable. I don't want to undermine one class and say it's more important than the other, because I do think they're equally important. I think that there's just more technical stuff going on with the critical care stuff that you're learning in 4th semester, and that's really valuable to know also.
So for 3rd semester, anybody who's not in 4th and already put in their requests for preceptorship, my suggestion is challenge yourself with whatever you request for preceptorship. Personally, I didn't choose something that I was thinking it was a job interview. Because everybody that I know who planned on it being a job interview at YRMC did not get hired at YRMC. So do whatever department you really want to be in, or where you didn't get as much experience in your clinicals, but push yourself. I absolutely had a blast in peds. Can't see myself anywhere else. It's hard to get a job as a new grad in peds. So, but that's my personal thing. Like, go for Mayo, go for Flag, go for St. Joe's if they open it back up. Like, push yourself. If you've done 2nd and 3rd clinicals at YRMC, personal opinion, I don't know what these girls did, but personal opinion, don't go back to YRMC. I had friends who did 2nd and 3rd at Verde Valley, and they did 4th preceptorship at Verde Valley. And I'm like, seriously, people, you saw the exact same patients,
I was there 3
nurses,
semesters.
doctors.
I have no complaints.
I was going to say also, I know not everybody can go live in Phoenix for 4 weeks. Like people have family.
Yeah.
But and
I
on
have
that
a
note,
4-year-old, and I went and lived in Flag for a month.
good.
So,
But not everybody can make that work.
I can't do that.
So, and also, like, okay, you might want to go exactly where you want to, but I did Mayo, and I did med-surg at Mayo, and I thought that that was really valuable for learning, like, time management as a nurse. Because by midterm, I had everybody. And I had a man with 2 JPs, and a drain coming out of his perineal area, and 2 ostomies. And someone who had delirium, who was, like, 185, and screaming the whole time. And she was getting Ativan, she was getting Haldol, and she was getting fentanyl every half an hour. So you still get some pretty cool stuff in med-surg, but it also helps you to identify where you need to put your time and how to prioritize patients. And you get that with pediatrics too, because you still have more than one patient. So it's like a med-surg pediatric
it
unit.
is. Yeah, I wasn't
So you
saying
still
anything
get
bad
that.
about med-surg. I was just saying, try a different facility. Try a different...
If you can.
If
If you can, because then you get a little bit of a different vibe about how different facilities do things. But if you can't, and you can't make it work, then just maybe like focus on learning how to time manage, because every single nursing job that you're going to get, you're going to have to time manage regardless. Unless you get blessed and you only have 1 patient, but then you still might have to time manage based on where you're going to put your charting and where you're going to put your care and what you're going to do as far as the administrative side of the job.
I would definitely say if you're in 3rd semester or whatever, start thinking about your preceptorship choice right now, because I waited till the last week and I was like, do I want to go for Mayo? Do I not want to go for Mayo? Do I want to go for Mayo? I didn't end up getting Mayo. I found out last week. But I'm glad that I did, because my husband was like, you'll never get another opportunity like that. So just keep that in mind. You will never get another opportunity like that unless you're hired there.
And Mayo's the cream of the crop, I'm going to be real. Like, we had like 4 patients, and they all, every single one, we had people flying all over the United States to come there, and they were all like, I would not come anywhere else. It was a beautiful opportunity, and they're really great at figuring out things that nobody else figures out. Yeah.
And if you are out of town, whether you go Phoenix or Flag or wherever, get a couple of friends who are in the same area and share a hotel room. So since I was on night shift, I never saw my roommates. I split a room with 3 girls, and it was super cheap, or 2 other girls. And it was just nice knowing that I had a place to go. So, yeah.
Okay, any other questions? I know we've been talking a lot.
That's what we asked you to do.
Yeah, outstanding. Thank you.
You're going to go inspired and practice.
That's how we
just
treat. And all else fails, take a night off.
And it's okay to,
If you need that for your psyche, take a night off. I went and saw Lion King on Broadway, and I had a great time. I went shopping. I did retail therapy after psych clinicals.
I'd say
I ate a lot.
Just break it down piece by piece and be really good with your time. Just chip it away. You'll be fine. You just got to stay consistent. And it's only by 7 a.m. and don't freak out.
And don't wait.
It's hard. You know it's hard. That's why we're here. We want to be nurses.
and it's okay to
We
cry.
expect it hard.
And right now, take advantage of your family. Like,
Yes.
take full advantage, because once you're working, they're going to take advantage of you. Because they're going to say,
You're done with school.
what's this?
Oh, I know.
What's this?
Oh, yeah.
I already get that.
I did that too. I had to take out stitches already. They're like, I don't want to go to the hospital. Can you do that? Probably shouldn't, but.
Oh, why not?
Oh, and then apply for jobs that aren't just new grad jobs. So just get your resume out
That's
there.
nice.
Is there a method to apply?
Can I tell you something that I did that I think really sealed the deal? And she did too. We made these like really great books, and Staples, if you want to get like crazy, will actually print them for you for $6
Oh,
or
really?
$11. We did it with. She did it different. She did hers with like they have these like
You know the
laminate.
report covers with the slide-on binding?
Use those if you don't want to get it printed.
She had it printed and slide-on bound.
With like your resume and stuff? Did you
Resume,
do
cover letter. I made my nursing philosophy and short and long-term goals, and I made that a page. I put my certs. I put some of the hospital, like the nurses at the hospital, what they wrote about me on those sheets. Copied some of those. I had my letters of reference. I had a page just for references. So it was like the portfolio that we used to have to do, but I just kind of like crammed it all into 17 pages. And then I was able to hand that, and it looks great because you've got this like beautiful thing. I put what my ACLS and my CPR in there. So you put your basics, what are they going to ask about anyways? And then I put that in there.
And they say, I did 4 interviews. They all seemed really impressed by it. It's just a good feeling. So.
Yeah, she had 4 offers.
You had
You just
4
killed it.
offers?
She got to be picky.
Do you really think it's like super difficult to get a job as a new grad here
Be
in town?
persistent.
You have to be ready to work nights. That's the deal.
Yeah,
Well,
be
I'm
ready
on
to
this side on this.
Well, it depends on what you're looking for. Right now, my husband and I have agreed that we have a little bit of flexibility. And so for the rest of February, I'm holding out for more of my dream job in peds. And so like March 1st, we might reevaluate that. And so I have not applied for any long-term care or nursing home. So that's because that's the conversation we had. So yeah, I had 1 interview and I didn't get the offer. So yeah, I feel pretty bad, but like that's the decision my husband and I made. Is that we want me to be happy and it to be worthwhile. So
There are also a lot of psychiatric facilities that are willing to hire. Just be prepared to work nights, and maybe be prepared to have a little bit of autonomy, like you're working a little bit more on your own. So at nights you might not have the opportunity.
You want to work right away.
Or unless you get the new grad program at one of the hospitals or something like that. But there's nothing wrong with long-term care. You learn how to prioritize really well. You still get to keep most of your skills. And you get to know a lot of, and some of it's rehab, so you get to do some more acute skills there. But with the long-term care, you get to find people and learn their stories. And I worked as an aide in long-term care, and I loved it. I loved getting to know the residents and stuff like that. So, and you're going to have like 20 patients. So, I mean, there's definitely time management and prioritization there. So don't feel bad if that's what you get. It's a good experience. You still get to keep your skills and get to meet new people, and it's a good opportunity. It's benefits. Who cares?
Yeah.
Right? It's experience and it's benefits. And a paycheck.
yourself, nobody else will do it for you.
Exactly.
Thank you very much.
Congratulations for surviving.
You will too.
Yeah.
Thank you.